Welcome everybody to another edition of You and Me and Multiple Sclerosis. My name is Pam and I've been living with multiple sclerosis for 37 years. And I'm always coming up with questions and looking into things and finding new things to share with everyone. I sometimes play the what if game. Do you find that you do that too? I think to myself, okay, what if I never had MS? But even more than that, I find myself thinking, okay, what if I had been diagnosed with MS sooner? Or what if I'd been diagnosed with MS today with all of the medications that are proven very effective at keeping people from going from relapsing remitting MS to secondary progressive MS where I am now? Would I have been able to manage my MS differently? Would I maybe not have the level of disability that I have? Well, it just so happens that across my desk in rapid succession came a couple of different articles, and I also read a book that was interesting. So I want to share all that with you today as a way of answering, or at least suggesting, an answer to the question, would I have done better with my MS if I had gotten treatment sooner, or would I be in about the same place if I had left my MS untreated? Well, look here. It just so happened that on February 14th of this year, Everyday Health, which is a newsletter that I subscribe to that comes into my inbox, had an article titled, "What Happens If Multiple Sclerosis Goes Untreated?" So they were dealing kind of with the what if question, right? And I'm just going to abstract a few paragraphs from the article. I'll link the whole thing, though, in the description box below. So let me just read you a little bit of this. Because the course of MS can vary dramatically from person to person, it's hard to know with absolute certainty what the prognosis will be for an individual who doesn't get treatment. But that lack of predictability doesn't mean that a wait-and-see approach is a good idea, says Justin Abatamarco, MD, a neurologist at the Cleveland Clinic who specializes in treating multiple sclerosis. Dr. Abatamarco goes on to say, there is evidence that patients with relapsing remitting MS who remain off MS disease-modifying therapies will have more frequent relapses and more frequent disability accrual, and they'll have a higher chance for developing secondary progressive multiple sclerosis. Okay. And then, on the other hand, a study published in January 2019 in the Journal of the American Medical Association provides some evidence that treatment with more highly effective MS therapies soon after diagnosis is associated with a lower risk of transitioning to SPMS. And then just 3 days later, on February 17th, I saw an article from Dr. Gavin Giovannoni, who is, as you know, someone that I have a lot of respect for and follow a great deal. He had published an article in his MS Selfie called Case Study, Does Treating MS Early Improve Survival? And I've just abstracted a couple of paragraphs from that article, although I will link the whole thing down below in the description. Death from MS-related complications is something that they were looking at in the study, and the study suggested that those who were treated with interferon beta, and bear in mind, to do a long-term study, you need to use a medicine that's been around for a long time, right? And interferon beta used to be the go-to treatment for multiple sclerosis when they first came out with actual therapies. So this is the one that they had available to use at the time. Obviously, some of the newer ones haven't been around long enough to do a long-term study of this nature. So the study suggests, though, that those who were treated with interferon beta increases your life expectancy by reducing MS-related complications that can cause death in the future. So in other words, you don't die of MS, but you can get conditions because you have MS that can hasten your demise. The latter includes swallowing problems that are associated with aspiration pneumonia. So in other words, if your food goes down the wrong pipe, as my mom used to say, you can get pneumonia from that. You can also have urinary dysfunction that can lead to a urinary tract infection or even septicemia, immobility, pressure sores, falls, and fractures. So any of these things, which can be a result of having MS, can end up causing you serious, life-threatening long-term problems. And then what this study clearly shows, according to Dr. Giovannoni, is that delaying access to treatment by just 3 to 5 years has a major impact on long-term disease outcomes. Well, just looking at those two articles, I guess I would have to say that my what if question was answered, right? It's pretty open and shut. If you don't get therapy and if you don't get it early, you can expect to go into secondary progressive MS, etc., etc. End of story. But they also admit in the Everyday Health article that MS isn't like other diseases. It's very unpredictable, and no two people have quite the same course of it. So I was quite heartened to read a memoir that I came across recently by a woman named Laurice Karrell. And I will put a link to that down below where you can get it on Amazon or probably other places too. She talks about living with multiple sclerosis for 50 years and not being diagnosed for 25 years. And you know, what's interesting to me as I read through all of what she went through, I really can relate to her because she's a lot like me in some ways. She was a technical editor, and so was I. And she was a manager, although she didn't like that. Now, I did like being a manager. She didn't. So that's one thing that's different. But she liked English as a subject. She liked to write. She was a hard worker. She loved to research things, and I do too. So I shared that with her. In fact, as I read her memoir, I thought, you can tell she's a technical editor because the way she presented her information was a lot like the kinds of things that you see in technical manuals and whatnot, in the sense that, not that it was devoid of emotion or human flavor to it, but it was very organized, and she kind of systematically went through her life and detailed the different symptoms. She says that early on, she decided that she would start documenting all the different symptoms that she had. And I will go through some of those right now and show you what she went through. She probably had some symptoms that would be called, what we would say now would be the MS prodrome, so symptoms that couldn't specifically be tied to MS, but that as you look back on them, you say to yourself, yeah, that was probably part of your MS prodrome, the symptoms before you could actually say that you had multiple sclerosis. So let's take a look. I'm just going to go through some of what she has here so you can see the kinds of things that she has gone through over the years and years that she's been dealing with multiple sclerosis. I'd like to just read to you the beginning of the book where she talks about who she's intended this book for. She says, for those of you who have been newly diagnosed with MS, this book is meant to demonstrate that you are able to live long, productive, and normal lives, especially if you were diagnosed with MS when you were young. But for those of you who are living with MS, this book may help you to identify your symptoms and experiences with the ones that I have experienced over the many years. She was told early on that, and this is still thought of as correct, that if you are diagnosed with MS as a young person, or if you get your first symptoms when you're young, you do better in the long run than if the first symptoms that you have are when you're older. And of course, older, younger is a relative thing, but MS is most commonly a disease that hits people in their 20s, maybe in their 30s for the first time. But the older you are, like if you're in your 50s, your 60s, or older than that, it tends to go quickly into progressive MS. She was born in 1930. And probably the first thing that happened to her that we look back at it now and say, yeah, that was probably MS, or the beginnings of it, happened in 1955. I'll refer to it as the bridesmaid incident because she was often asked to be a bridesmaid at her friends' weddings. But she remembers that in 1955 she was in a wedding and walking down the aisle, and she was supposed to take really short steps in order to stay, with the right tempo as they walked down. And it became really difficult for her to do that. In fact, she lost her balance and pitched forward, and she said she didn't fall. And it's a good thing that everybody's attention was on the bride because she felt very foolish. But she did manage to get through that. And as she says later on, this is not something that ever really went away. She's always had trouble taking short steps because her balance is not all that great. Then in 1958, she had what I'll refer to as the swimming incident. She was in the water and she was doing fine. But then she went to get out of the water and she found that she had a very difficult time. All of a sudden, she couldn't even stand. And I relate to this because I remember when I was down in Hawaii with my husband, and this would have been back in the 90s, we went snorkeling and we were in the water for quite some time. And when I went to try and get out of the water, my legs just wouldn't hold me up. And I thought it was funny at the time. I was just kind of laughing. I think by then I knew I had MS, but still was kind of a strange sensation not to be able to get my legs to cooperate. Well, I'm just going to take you through the number of different symptoms that she's had over all of the years that she's had MS. I have not put all the dates in here. In her memoir, she does give you the dates when all these things happened. But I want you to know that it was almost like one thing after another for 50 years. Remember, we already talked about the imbalance when taking short steps, and she said this hasn't changed. She hasn't been able to do it. Her balance is not good enough. And then that second one is the vertigo that she had along with not being able to stand up when she got out of the swimming pool. Her balance was really, really impaired. And she said she no longer experiences it to that extent, but she does have problems with her balance. Something that happened to her only once was she was holding a cup when she was out with her friends having coffee, and the cup just kind of slipped out of her hand. And it surprised everyone, including her. And thankfully, that incident never repeated itself. She continued to have vertigo and imbalance. It never did go away. It's sometimes better, sometimes worse. Sounds familiar, doesn't it? And then she talks about an extensive and lengthy vertigo and imbalance exacerbation, but that never repeated itself. So the really severe one that she had did not, thankfully, repeat itself. And then we get to opticneuritis, not till 1970, which to me is pretty interesting because for me, and I think for many people with MS, our first symptom was optic neuritis. But here's the thing. She didn't just get it in one eye at a time. The first time she got it in both eyes. First one, then the other. There was quite a long period of time when she was essentially blind. And that must have been awfully frightening. She talks about that it really was. And of course, with the kind of work that she did, she wasn't able to work. And thankfully at that time, they kept her job for her for all the months that she had to be off work because she just couldn't see. I remember when I had optic neuritis in my left eye for the first time, I couldn't see out of that one eye. And in order to drive back and forth to work, I had to put an eye patch on like a pirate because I could see just enough that it was throwing off my depth perception and everything. So it was easier just not to be able to see at all. I remember my one customer saying to me, if you're only editing with one eye, shouldn't I only have to pay half as much? And I thought that was just too funny, right? But I told him maybe I ought to make you pay twice as much because it's twice the effort that it was before. So she had her optic neuritis that couple of times, as you see there, and then never had it again. I had it, I don't know, probably 6 times total, maybe every 14 months or so. First one eye, then the other, then the other. And I was being treated with steroids for the first bunch of them, but the last one that I had, they went through this weird patch where they decided that steroids were contraindicated for treating optic neuritis, and so I just had to tough it out, with the result that my one optic nerve is pretty badly scarred. It's really kind of unfortunate. They got over that one pretty quickly, but not in time to help me out. Anyway, continuing on with her, she had this sensation of spinning and being suspended. And she said that she takes medications when she flies because that was the time when she would get these sensations the worst, was when she was flying. She said she doesn't get them very often anymore. Thank goodness. Electric shock-like sensations, the all too familiar trigeminal neuralgia type sensations, right? I continue to have the feeling that something is lodged in my throat and I get a metallic taste in my mouth. Very interesting. I remember years and years ago, and I do think that this was before I knew I had MS, I had a time period where nothing tasted normal at all. Everything tasted like blood, quite honestly. The only thing that I could stand at all that tasted anything like it should was, of all things, potato pancakes. Now, you can't live on potato pancakes, but it sure was nice to be able to eat something that actually tasted like food. I think I probably lost some weight during those weeks. I don't remember how long it lasted, but that was one sensation I was really glad to get rid of. She does say that her right eye is still sensitive and occasionally waters, and if she's late in taking her medications, she starts to get those electric shock sensations again. So her medication is helping her with that. And that's what we call symptom management. It's not curing anything, but at least it makes life bearable. And then she talks about thyroid surgery, which was sort of an experimental treatment to see if it would alleviate MS sensations. This is another thing that those of us who were diagnosed with MS fairly early on found, that we were being invited to try some experimental therapy so that it might work, and who knew, right? The surgery didn't cure the MS sensations in her throat, the metallic taste that she had, and now, because she had that part of her thyroid removed, she has to take thyroid medication for the rest of her life. And then she talks about sensitivity to temperature, which actually for me was probably part of the prodrome, but she says that it wasn't really a big deal for her until later on. She said over the years, her sensitivity to temperature has persisted and become more pronounced. She said she used to not ever perspire, and now she perspires profusely from excessive heat and high humidity. And the slightest change in temperature affects me. Also, my forehead is cold most of the time. And that is pretty typical of folks with MS, that heat and humidity are very, very hard to deal with. Whereas when she was younger, she loved the heat. And even when she was having symptoms that we now recognize as MS, the heat didn't bother her for a long time. It wasn't till later on. Then she talks about uncontrollable jerky movements, and she said she still gets those occasionally. Well, actually more than occasionally. She gets them fairly often. She had one incident of double vision, but thankfully that never repeated itself. She talks about numb and binding feet, the sensation that her feet were numb and that they were somehow bound up like in bandages or something. She said the sensation has never subsided. My feet are still uncomfortably numb. When my neurologist places the buzzer on my feet, I don't feel the buzz on my feet or the buzzer, and I once broke a baby toe without even realizing it. I remember for a long time I had the feeling that my socks were bunched up under my toes, and it clearly wasn't the case. Even when my feet were bare, I felt that feeling. It was very strange. Thankfully, that one did go away for me. And then she talks about trigeminal neuralgia specifically, the electric shock pain on my upper teeth, cheek, and lip area. Thankfully, it never returned, but she got it elsewhere on her face. And then a burning and tingling pain in her legs. This sensation has worsened over the years, she says. I continue to get this instantaneous burning and tingling pain on my legs very often. And then she talks about a foreign object sensation, and she says, I rarely experience this sensation now. But yes, our nervous system is so strange. When it starts to malfunction, all kinds of strange sensations happen, and we may live with that for a long time and it may go away. We don't know. And then muscle spasms on legs and feet. And she said that's increased over the years. She very often experiences the spasms, especially when she's lying down, and they are often very severe. By the way, I want to take a moment here just to say, one thing that becomes very clear in reading through her memoir is that this woman has an incredible tolerance for pain. She talks about having some symptoms that I would think, she even describes them as excruciating, but it doesn't stop her from working, from doing the things that she wants to do or needs to do. I'm just in awe. There's no way I could go through my workday if I was having trigeminal neuralgia attacks all the time. She said that one time she fell and broke her arm and didn't get it reset or anything, but she was in awful pain. She told the doctor about it, and he said, well, you can't have broken your arm, because if you did, you'd be in awful pain. You'd be screaming and crying, and you just couldn't stand it. And she said, no, you don't understand. I am in horrible pain. So, yeah, I think it helps in a disease like MS. It helps if you do have a high pain threshold. And then finally, a fractured left arm due to imbalance. That was what I was talking about, I think. And then just a few more things. I put some dates in here just to show you how long this has persisted. It started back in the 50s, and now in 2001, she talked about getting numb fingertips in both of her hands, the left hand more than the right, and in 2007, the fingertips on her right hand became numb in 2007. And then she talks about having a strange swollen ankles, legs, needle-like pricks, and it lasted a while, but when it went away, it did not come back. That was in 2006, as I say below there. And then I just wanted you to notice that she retired in 2002 at the age of 72. So MS did not drive her from the workforce. In fact, only because her company downsized people, and she was one of the folks that got downsized, did she quit. Who knows how long she would have continued to work. She loved what she did, and she just kept going. So hats off to her. I had to leave the workforce in my 40s, but she hung in there till 72. In 2007, she talked about the trigeminal neuralgia of her forehead and her right eye. That lasted for 2 weeks, and it reappeared briefly in 2010. She said that the forehead and right eye pain was nowhere near as excruciating as the pain that she had in her jaw when that was going on. And then in 2009, she had a severe, inexplicable fall, and it resulted in broken bones, and it required her to be hospitalized and in rehab for quite some time. Because the fall caused a concussion, she doesn't really remember anything much about what happened just before the fall, but one can only assume that MS must have played some kind of role in there somehow. So the moral of the story is that you can't predict, right? Even though I think as a general rule, it probably does make sense to get on some kind of disease-modifying therapy early, you don't necessarily know that would make all the difference between being able to continue living your life or not. And I think that Ms. Karrell's story helps us to understand that. Look at the litany of symptoms that she had to deal with, and yet she continued to work until an age where almost anyone else would say, oh, come on, why don't you retire? She loved what she did. And not just work. She and her husband did things. They went on vacations. They enjoyed life. And so it's not like another disease. But our eyes should be on the prize in a way. We want to be looking ahead to the day when multiple sclerosis is a disease that can be cured like so many of the other diseases that we have managed to cure in modern times. It doesn't have to lead to the kind of uncertainties and speculations about the future that most of us are dealing with now. We could play the what if game all day long, but the best thing to ask maybe is, what if in our lifetime there is a cure for multiple sclerosis? Dr. Giovannoni tells of when he was a fourth-year medical student, the very first patient, actual patient he saw was a woman who had been hospitalized with many, many MS symptoms. She was having a horrible time. A lot of different things going wrong with her. And he said that he could tell that he was seeing a nervous system in the process of failing. And he didn't know at the time how to talk to her really. He realizes now he was probably very brash and not very sympathetic, not very understanding at all. He's learned a lot over the years. He said, if this woman came into my office now, I would have a very different thing to say to her than I could say to her back then in 1985. And I will end by just reading to you his words, and I think it's a good way to end this thing on a positive note. The what if question we should all be asking is, what if we live long enough to see a cure for multiple sclerosis? If this woman with MS, who influenced my early career so much, came into my consulting room today, the story I would tell her would be a very different one, an inspiring story of innovation and hope. I predict a future in which people with MS live healthy lives into old age, free of disability and the worry that is such an integral part of living with MS. And to that I say, hear, hear, and amen, Dr. Giovannoni. I hope I'm around when you and your team cure multiple sclerosis.